All right, well, health news now. The age-old bane of teenagers and children. We're talking about acne here.
Yeah, it can be physically and psychologically scarring. But CBS 2's Dr. Max Gomez says for the first time, there are now guidelines on how to treat it.
That's right, Christine Maurice. You know, while acne has likely been around as long as there have been teenagers, doctors are seeing more and more cases in younger children, perhaps because kids are entering puberty earlier these days. The good news is that there are now many effective treatments, so young folks don't have to suffer. For several years, Nicholas Travis was embarrassed about his skin. The 15-year-old hated the severe acne he saw when he looked in the mirror.
It was really inflamed and painful, even to touch it.
His pimples on his face, chest, and back changed his behavior.
You feel different, in a bad way.
Generally, Nicholas has been a very outgoing kid, but when the acne really got severe, he'd come home from school sometimes and tell me that the kids were making fun of him, or he just felt very self-conscious.
Now, for the first time, the American Academy of Pediatrics is backing new guidelines for the treatment of acne in children and teens.
Acne in kids is really nothing new, but for the first time we have enough evidence to develop evidence-based guidelines for the diagnosis and treatment of pediatric acne, and so that's pretty exciting.
The guidelines say most cases of mild acne should be treated with over-the-counter medications and include either benzoyl peroxide or salicylic acid. If that doesn't work, the next steps are using prescription topical retinoids like Retin-A or Differin, possibly with oral antibiotics. For really resistant acne, there's prescription drugs like Clarivis, a newer version of Accutane.
You see the red marks here, those are on their way out.
Nicholas used a trio of treatments to clear up his acne.
It's so much better. Socially, I can talk to people now.
He had the confidence that he once had, and it's because he's not self-conscious about his appearance anymore.
That's why Nicholas's dad urges other parents to get their kids treated as quickly as possible. Now, as for side effects, any topical treatment can cause skin irritation and dryness. Antibiotics can cause stomach upset or yeast infections in females. Accutane-type drugs are very effective, but they can cause severe birth defects if you take them while pregnant. So the FDA requires strict abstinence or 2 forms of birth control while taking the drug. Maurice, Christine?
Dr. Max, thanks.